Hello, everyone. So here we go live for the first time on this channel. Hello, once again. For the first time on this channel, we are going live. And today's discussion would be about how we can reduce the runaway fresh figures of COVID, which we are seeing of late. Many are saying that this is going to be the second big wave, the tsunami wave, which is going to hit all of us the world over. Are we up for it, or are we all going to perish? We'll take a look. And for people, those who are scared of this upcoming second wave, don't you worry, we have a solution here. And it is something that each one of us, we can actually take it forward if we implement it ourselves within our own families, within the areas where we stay, the housing complexes and the neighborhoods and the city area and the entire city and the country, therefore, then in that case, each and every country will be able to put an end to this menace called COVID-19. And yes, we can do it. Let's take a look. Right now, today, it is the 24th of November 2020. We have about 440,000 odd pending cases of COVID-19 patients to be treated and to be released or discharged from various hospitals throughout India. Okay. And what we have been seeing of late has been that roughly about a week or so back, we were finding that almost every day we had a difference of 10,000 of absolute numbers as a difference between the fresh cases of COVID per day and the numbers who are actually getting discharged or who are actually, given treatment and taken out of hospitals. So that difference was 10,000. So if we were to take a look at 40 days, or for that matter, 44 days multiplied by 10,000 every single day of the 44 days, it would add up to a figure of 440,000 or 440,000, which means starting today, another 44 days, if we were to actually have a difference between the fresh new cases and the discharged ones, we are looking at 440,000 cases to be solved or released from hospital, which means we are down to zero number of cases, fresh cases. Okay, so that is possible if we were to get to, stick to the 10,000 absolute numbers per day. And if this has been possible of late to make that difference of 10,000 or more or thereabouts, then it is definitely possible to, keep doing those numbers on a single and every single day going forward also for the next 44 days. 44 days would mean something like about 1 month and a fortnight, which is 1.5 months. It's all that we need to do to completely eradicate this disease, this dreaded disease from our country. And similarly, we can actually use this model to be used everywhere else in the world so that, we don't have any fresh cases coming in from outside of India as well. So that is what the basic idea is. Right now, we've got a couple of people coming in. Do we have someone? Yeah, we've got Ashwin coming in. So Ashwin, would you like to say something about how we are going to be, tackling this? You are, what is your profession? What do you do? I'm just waiting for your reply. In case if anyone is there apart from Ashwin, you can just start, responding back with your idea about what you would want to do specifically as to, in case if you're a student, for example, and if you're going to school, or about to go to school. Like, for example, some states have started classes already when it comes to standard 9 onwards. So what is your opinion about attending to schools physically or to colleges physically? Is there something that you can think about in terms of a solution, or are you going to go ahead with the schooling physically, or are you okay with your existing practice, that of the live streaming of classes, or the virtual classrooms, as it were, as we call it? So we can look forward to your comments, or you can just come in and put in a live video as well. So we look forward to your comments on this. Yes, Aniket, good to see your comment here. Self precaution is must. Aniket Gurav is saying this, going with masks, sanitizing. So that's wonderful. I mean, that is definitely the way forward, so that we are able to safeguard ourselves and our close ones also. So that is really good to hear that. Gaurav, where are you from? Which city are you from? Aniket Gurav. Going by your surname, I think. Okay, you're from Raigad, Alibag. Okay, okay, that's a wonderful place. Yes. So, how has it been? I mean, recently we had the tsunami. I mean, some kind of a natural disaster hitting Alibag. So I hope everything is cool out there. You all are safe there. And how is the COVID situation there in Alibag? Okay, so while we get to hear from Aniket, we will also, keep discussing about some of the ways in which we can actually help in. Okay, Aniket has replied, that was the worst case I have seen in my life regarding cyclone. Yeah, the cyclone which had hit all of us recently. So I hope nothing untoward or nothing drastically bad happened with you and your family. Let's hope everyone is safe there. And so, yes, we are discussing about COVID and how we can be very, very safe from COVID. We've done a few three different videos within this particular channel, and I'm sure each one of those videos will be of use to you in case if you are looking at wanting to be safe from COVID. Yeah. So if we were to talk about COVID and how we can, get to be much more, let's say, safer. Of course, apart from the hand sanitizers, you need to use a mask, which is the mask which covers your nose and the mouth, but also the face shield, so that the airborne or the aerosol transmission of virulent particles or droplets which contain the COVID virus, possibly or potentially, cannot enter your eyes and eventually infect you. So these are things which are required. Apart from that, you need to maintain social distancing. But of late, as we have seen, most of the public transport, we are seeing it is starting to have a lot of people getting in, and sometimes it is not that practically possible to keep social distancing. Yet try and use as much of these precautions. These are precautions, and therefore these are lifesavers. So not only will it save your life, when you reach back home, in case if you are asymptomatic after a bout of travel outside, if you come back home, you may actually risk the lives of your elderly people at home, or the young ones, very young ones. So they are vulnerable, and you need to keep track of their health as well. Okay, we've got okay, Aniket further says that Corona is under control here. Okay, yeah, that's pretty good. I mean, let's hope that is the case, and more people should be able to say this, and we should be able to reduce the numbers so that the absolute numbers per day tend to go up than what it is right now, and that will help us to actually completely eradicate the disease in about a month and a half to about 2 months time from now. So in case if the second wave does not hit us bad, and in case if a stronger or far more mutated version of this virus does not come and hit us. Okay, so let's hope that's not the case. Further, we've got Ashwin coming forward and putting in a comment. Even if social distancing is maintained, this virus is going to spread. Okay, that is what he's saying. And according to me, we should not send our country's future into danger. Okay, schools should only be opened after the eradication. Okay, that's a wonderful thought, and quite practical one at that. Okay, so yes, I mean, the future of the country are the kids and the younger lot and the younger generation. So we should be able to safeguard them for the sake of our nation's future. And obviously, I mean, what Ashwin is saying is that we should look forward to eradicating this virus before we send children to school, because children coming from various socioeconomic stratas and different backgrounds and different kinds of environments, you never know how it can affect the rest of the kids in case if one of them is actually affected, because classrooms tend to be enclosed areas, and they can actually spread the virus around and affect so many innocents who are there in the classrooms. In spite of, let's say, social distancing being maintained, instead of three students to a bench, even if it is one student to an entire bench, which is one third the classroom strength to be given on a particular day of the week. Even then, if there is a rotation of the children in the classrooms per day of the week, even then, in an enclosed enclosure like a well ventilated classroom, also there could be chances of the children getting infected by this COVID-19 virus. Also, wearing a mask throughout the day, or even half a day, even for that matter, half an hour, is also pretty cumbersome, and it leads to a lot of hypoxia kind of situations when the carbon dioxide which is exhaled out can also lead to less of oxygen intake and affecting the brain tissues or cells. So that also is a major kind of a cause of worry, apart from the pulmonary functions that can also get affected. So so let's hope that we are able to put an end to this menace of COVID-19 faster by trying to have the fresh new cases not rising per day, which is a worry of late for the last couple of days now. We've been seeing a slight spike in the number of new cases. We don't want that happening more and more. Let's possibly, because if we've had recent spate of various types of various festivals from various communities which took place recently in the last 1 month or so, and it's pretty obvious. I mean, these are festivals which are community based, and you have the involvement of the entire families and communities coming together. Not just one community in India celebrates one community's festival, the other communities also come together as a show of unity to help in creating that bonding, and there is a lot of bonhomie which is all around festivals. That is what India is well known for. But at the same time, in a situation like COVID-19, I mean, this is something which is unprecedented, and therefore people are not used to taking evasive action when it comes to following certain norms as regards fighting this kind of a disease, which is it's an unknown force, unseen. It's not in front of you, yet it can actually cause devastation amongst the masses of population and within communities. Therefore, yes, that's the unfortunate situation that you've got several of these festivals in India. It's a land of festivals, so obviously every month we've got one festival the other, which is also a bit of a worry for a country like India, because the moment we try to reduce the numbers of fresh new cases, again there is something or the other which is a community-based activity which happens like a festival or so, and or a political kind of event where there's an election and there are people those who come together, and it leads to a spike of fresh new cases, which is quite an unfortunate situation. But yes, most people by and large are aware of what to do, are trying to do the best that they can to maintain social distancing, to maintain the precautions as far as usage of the masks and the face shields and the hand sanitizers, and also building up immunity when it comes to intake of proper food, exercise, and and the like. So all of it goes a long way in terms of building immunity and to thwart the disease and to keep the disease at bay for as much as is possible, practically possible. So yeah, so these are kind of issues that we've been grappling with, and that is the reason why I thought I should come forward, and at least from my part, I can put forward some of these points which I believe would be of interest to all of you, and you will find it of interest and use to actually consider using these points in your daily life, and also to thereafter let more and more people know about it, spread the good word around about how to actually try and keep your communities safer, your environment and your neighborhoods safer. And in trying to do that, each and every such neighborhood comes together to form a larger mass of people and population, and which will then be safe and leading to the entire country also becoming safer. So that leads to economic progress also, which is bound to happen going forward. So which is why it is very essential that people get into jobs and are able to do jobs. In order for them to get into jobs and for jobs to be available, we need the pandemic to actually go away from India as fast as possible. So we should all do whatever it takes to actually fight this tooth and nail. So we've got Ashwin also once again putting in with a comment. He's asking a question. It seems okay. It goes like this: can we contain the virus without vaccines? If yes, then how and till when? If no, what is the solution to this according to you? Okay. Uh, yeah, I mean, we can definitely, contain the contain the virus with vaccines, or without the vaccines. Okay, let's talk about without the vaccine. So, without the vaccine, the only way we can contain it is by not letting the fresh new cases rise. And as we've just mentioned about the different ways in which we can actually try and contain the virus by way of social distancing, usage of masks, usage of sanitizers, building a good immunity, spreading the good word around, so that more and more people are aware about what it takes to actually keep the disease at bay, the virus at bay. So those are ways in which, without the vaccine, we can actually contain the virus. Okay, that's one. Second is we can also use certain kind of processes, like for example, I mean, in this particular episode, I mean, this particular channel itself, we've discussed before that a timetable can be set for certain neighborhoods, so that people come out for purchases on certain days of the week according to the neighborhood, which is divided into certain blocks, and each block goes out shopping on certain times of the day or for certain days of the week only. So we spread out that information in that particular neighborhood, and everyone knows exactly when to go out shopping. So if there is an entire neighborhood which is about maybe 100,000 people in that area, I mean, divided into six blocks, so that one person goes from Monday to one block goes out shopping on one day of the week, and likewise each of those blocks get one day of the week. Okay, Monday to Saturday, leaving aside the Sundays, because Sundays you may have a lot of people, wanting to do shopping from coming in from other areas apart from your area. So do all your shopping during the weekdays primarily, leaving out the Sundays because Sundays tend to be more crowded. So avoid the crowds. That's what the idea is. So that is the Excel sheet that as a timetable, which was there as one of the episodes in this particular channel itself. So do check it out and give me your comments. I'm sure you can actually use the same kind of a concept in your area and in your cities as well. And it goes true for any city in India or any of the other countries wherever you are coming in and taking a look at this particular episode. So do take it and use it at the maximum. Okay. So with the vaccine, yes, I mean with vaccine, Ashwin, we can actually also, try and contain the virus because those people, those who are going to get the vaccine, they are going to be primarily the initial ones would be given to the healthcare frontline workers who are the COVID warriors facing the virus right in front of them in the hospitals. So they will be given first. The elderly, senior citizens are going to be given, the children are going to be given first. So these are the kind of population segments who are going to be, given the vaccine initially, so that they are secured first, and then the other age groups in between who would be then finally given the vaccine. So that is how the government is going to plan it out. Having said that, this vaccine would last, or the efficacy of these vaccines are going to be only for about around about 3 months or so. So it's not going to last for long. So you need to be careful even thereafter. I mean, as many of the experts are saying that this particular disease is going to be here to stay for the next at least 1 to 2 years. So, and if the efficacy of a vaccine is only for 3 months, I mean, you can well imagine that vaccines are not going to be the answer or the only thing that is going to actually fight this disease. So it is definitely our discipline, our behavior, our social behavior when out in public. These are kind of things which are going to be of primary importance. So as a community, we need to actually educate and impart knowledge and share knowledge, as well as make more people aware of what to do and how to do it. But the more we are united in this kind of an aspect, we are going to be much more successful as individuals and as a community and as a country. So this is what is my take on this. Okay, we've got Aniket asking a question. Government is revoking all the restrictions. What's your say on this? Will it help to freeze COVID count? Okay. See, restrictions are going to be revoked. So, which means, which we've been seeing the unlocking. But at the same time, right now, some of the states are going back to restrictions. So, which means that some of those states like Madhya Pradesh, UP, Gujarat, and so on, we've just seen that over the last weekend they've actually imposed certain restrictions back into their societies. So, given that fresh spike in fresh cases have been taking place, and the numbers have been going up, even in Delhi also at the same time. So northern states, they are experiencing the bout of winter coming in, and during winter time, viruses do tend to remain much more stronger and robust and around for a larger duration of time. So they are able to have a larger shelf life, if you like. So therefore, they are going to remain potent that much more in the environment. So colder climates tend to do that. That is exactly what is happening in Europe. That is exactly what is happening in the United States in the colder climes as well. So that's a bit of a worry. So this winter, most of us, we are expecting the second wave, and this could be a devastating one. So we need to really pull ourselves together, get our acts together to really, fight it the best that we can, and don't venture out unnecessarily unless there is something of very big urgency. Otherwise, try and stay safe at home and keep others also safe at home. We've got, okay. So Aniket says that will it help to freeze COVID count? Yeah. So you see, if we are actually going to be, wanting to, put the restrictions back on track, definitely it is going to, start freezing the fresh new counts of COVID. For that is definitely goes without saying. So it remains to be seen. We are from Raigad, so Alibag in Maharashtra. So the Maharashtra government in the next 2 to 3 days time is going to take a call on this. So we shall wait and see how the decisions are going to be made. So till such time, it is our responsibility as citizens to really, hold on to our horses and just stay put at home, or maintain the precautions as we mentioned earlier in this episode. Okay, Ashwin has got another question. Should lockdown be put in place once again as we are experiencing a second stronger version of this virus? Yes, which is what we just mentioned. Um, that is a call that the government has to take, and we have to abide by it, whatever be the decisions taken. So we will wait and see till such time. As I said, let's do our bit, each one of our bit, to try and keep ourselves and our community safer. So it's been close to half an hour that we've been on this live show, and it's been a pleasure interacting with our audience, people like Ashwin, Aniket, and a few of the others who have been listening in. So who've been putting in your, likes to it. So uh, good to know that. So hopefully you've got some information from this particular episode, and do put in your comments later whenever you get a chance to, take a look at this particular episode. And I'll look forward to your comments and your, you know, support for this initiative, the initiative of wanting to, keep our community safe. So and in order to also, reduce the fresh new cases, that is very very important. It's a matter of life and death. So it's that important. So let's all join in and do our best, and we will definitely, win over this fight, and we will defeat COVID-19 virus and send it packing. Okay, saying that, I sign off. Adios, cheerios, take care, bye bye.